And we've done now thousands of these cases in our practice over years. And of course, each time Solta comes out with a different Thermage device, we begrudgingly upgrade because, of course, we don't like spending money. We're dermatologists. We like to make money. And in spite of that, with each improvement of the device, we've gotten better devices, more predictable results, and it's been worth every penny. And the return on the investment has been actually very significant, which I'll explain later. 50 clinical studies have been done on this device. We did the, I think, most important study of all, 5,700 patients, done worldwide, 16 centers, 94% patient satisfaction. The only other procedure in cosmetic dermatology, cosmetic medicine that comes close is botulinum toxin, which approaches in the high 90s. But to have a non-surgical facial tightening procedure with 94% patient satisfaction is incredibly high. Over 3 million of these procedures have been done over the last years. And I personally believe, in spite of the fact that we have other competing technologies in our practice for non-surgical skin tightening, it's my firm belief that Thermage FLX is the one single device that gives the most reproducible, predictable results in a relatively painless procedure that's well tolerated with no downtime. We've had almost not one single significant side effect in at least 5 years doing this procedure. I personally get this done once a year. My rule of thumb is under 50, once every 18 months, over 50, every 12 months. I usually don't do it more often. We do have some patients who are so thrilled with the result they want to do it every 6 months, which I tend not to do, but we never do it more often than every 6 months. And the real reason is it takes about 6 months to generate the most collagen you can from the procedure. So why not let it work its magic before doing the next procedure? So that's Thermage. Clear and Brilliant is basically Fraxel Light. It's a gentle, tiny, very adorable Fraxel, which I'll show you, which was first came onto the market a few years ago and then was totally retooled just a couple of years ago. We were the first center to use the device. We now use it extensively. I've also had this done. It's a little uncomfortable, topical anesthetic for 30 minutes. Procedure's done. The first pass barely hurts. Second pass, a little uncomfortable, but if I can tolerate it, anybody can tolerate it. Little redness and puffiness for about a day. I've been able to work the very next day, although I wouldn't choose to do so. I choose to take 1 day off. But with the real Fraxel, which we'll talk about, that's more like 2, 3, 4 days off. More aggressive, bigger device, more expensive, a little more uncomfortable. More than 15 studies that are published, over 2 million treatments with this device. And you know a device is good when all the other companies make devices to compete because it opens a brand new market. And the Clear and Brilliant Touch opened a brand new market for patients who wanted results of fractional resurfacing without the downtime and at a lower cost point. Smaller device, tabletop, portable, great for med spas because it can move room to room or spa to spa. We tend to keep ours in one spot because most of these devices do better when they don't move. But of course, we have one very big facility. If I had 3 offices, I might just take my touch with me or have my staff do so I don't need one in every practice. And then the Fraxel, which I've already touched on, it's been around now for 20 years. 2 devices, which we'll go over, $19.27 for superficial, $15.50 for deep treatments, over 90 clinical studies published, over 1.5 million treatments done. I actually do this. Originally, I did a series of them, and now I do it about once a year for maintenance therapy. It's more effective than touch. It costs more. It hurts more, has more downtime, but it's basically the better the results occur with more involved procedures. But many of our patients just don't want to have 3 or 4 days downtime, which is why having the touch is so nice. So Tighten and Brighten is Thermage plus either the touch or the Fraxel. So Clear and Brilliant or Fraxel, they help to shine, polish, even out color, tone, and texture, while Thermage helps to tighten the skin. And if you actually survey patients, we'll show you some data, those are the 2 most common things they come in looking for, evening color and a bit of tightening of their face. So these are procedures that can be done on the same day, and I'll tell you a bit more about this later on, but we usually do the Thermage first for tightening. That's a deeper procedure with no epidermal change, followed by either touch or the Fraxel, and they can be done back to back on the same day. In our practice, we tend not to do them on the same day just because of scheduling. But if someone comes from a distance, which many of our patients do, we will do the thermage first. We book a full hour. The treatment takes 45 minutes, no topical anesthetic, done by a registered nurse in our practice. Some practices have physicians do it. Other practices have estheticians do it. We choose to have registered nurses do that procedure. The Clear and Brilliant touch is done by estheticians in our med spa, which we have on site. And the Fraxel is done either by me or my colleagues, or we have a nurse's schedule where a few of our most senior nurses do those procedures. So a patient could come in and have thermage plus touch, or Clear and Brilliant, or come in and have thermage and then Fraxel, or they could have thermage and then on a different day entirely come in where they don't mind downtime. What's nice about thermage, remember, is it's a no downtime procedure. Truly, people talk about lunchtime procedures, which is a way overused acronym or term. But in this case, thermage, I've done it and I go and see patients as I walk out of the room. I tend to get quite red. After thermage, I'm pink for a minute or two. On the other hand, with Clear and Brilliant touch, I'm red, a little puffy overnight and a little bit the next day. And with Fraxel, if you do an aggressive Fraxel procedure, it's 3 or 4 days. So depending on the patient and what they can tolerate, we might do thermage plus Clear and Brilliant on the same day, or we might do thermage and Fraxel on the same day, or we might separate them out. But in a nutshell, Tighten and Brighten is Tighten with thermage, and then Brighten with either the Clear and Brilliant touch or the Fraxel. So who do we offer this to? In a nutshell, thermage is for patients who have some laxity, and I'll show you exactly what areas we look for. They don't need a facelift, but they want a bit of facial tightening. I saw patients all day today from 7:30 this morning till just minutes before we started this webinar. I saw about 35 patients. A number of them came in and said, by the way, I've noticed I'm sagging just a little bit. These are attractive women and men who care about their appearance, are not thinking about a facelift. They're usually around 35 to 50, and they've just got a little tiny bit of sagging. We assess them. Those are perfect candidates for thermage. And who's a candidate for Fraxel or Clear and Brilliant? Almost anybody who wants to brighten and even the tone of their skin and color. And as you know, as people age, of all skin colors from 1 to about 4 or even 5, uneven color is an unwanted feature. That's of all skin types, 1 to 6. Everybody looks better with one color, monotonal skin. A big study that was done years ago using dermatologists and plastic surgeons took pretty faces and computerized the face and then added brown spots that look like lentigines. And by adding lentigines to an otherwise flawless skin with no wrinkles and no sagging, increased the perceived age by 12 years. That's why makeup is so successful in women and some men, but why Clear and Brilliant and Fraxel are such successful procedures in our practice. They are the most successful 2 procedures at skincare physicians, where we saw 75,000 patients last year in one site. When patients say, if I was only going to do one thing, what should I do? It's either Clear and Brilliant touch or Fraxel, because it functionally improves the skin, and Fraxel decreases risk of skin cancer. So we like these procedures to tighten and brighten the skin, and they're highly successful in our practice. We treat all skin types with all 3 of these devices, from skin type 1 to skin type 6. If you look, and the 2 big groups of people who are watching this webinar are med spas, which, as you know, are growing incrementally and exponentially in the US, 30% increase in just the last 2 years alone. And dermatologists, who are the leading experts in skin, hair, and nails. When surveys were done of consumers, 28% of consumers were influenced to get a cosmetic procedure done by a dermatologist. 32% were influenced by dermatologists to make a skincare procedure. But most important, down below on the right, 52% of consumers' decisions to schedule an appointment were influenced by providers' social media presence. If you don't have a social media presence, whether you like it or not, you must have a presence. It can be highly tasteful, highly professional. It does not have to be advertising. It doesn't have to be you dancing half naked, which I find distasteful, but you can have a presence on social media. You must have one with a website and well-placed blogs or tasteful representations of what you do in your practice. Take a look at this information. Tighten Brighten fills the need of what consumers want most. In an ASDS, American Society of Dermatologic Surgery survey, 70% of responders were considering a cosmetic procedure, and 52% were considering laser, light, or ultrasound or radio frequency to tighten skin and smooth wrinkles. Tighten, brighten, and improving texture. So this is exactly what patients come in asking for. Many of your patients will come in and say, I don't know what I should do. Why don't you tell me? But really, you need to turn it back to them. The last thing you want to do is find flaws in their appearance because you might upset them and you will definitely scare them away. So I turn it back to my patients. We have handheld big mirrors in the top drawer of every exam room. I say, why don't we look together in the mirror and decide together? What bothers you when you look in the mirror or look at pictures? No one else is listening, just the two of us or three of us if my fellow's with me. Let's discuss what's bothering you. And usually it's brown spots, uneven color, dullness of their skin, which starts to dull in the 20s, usually about age 18, but really noticeable in the 30s and 40s, and a little bit of sagging, 1, 2, and 3. And so the Tighten and Brighten really addresses that for us. So the Thermage FLX is a versatile treatment which helps to expand your practice. It's suitable for all skin types. There's a single tip use for different parts of the face. We see improvement after a single treatment. And of course, it drives patient retention. I saw a patient today who said, gee, do you think it's time for another Thermage by name? I said, well, let's have a look. I gave her the mirror. Show me what bothers you. She pointed here, here, and here, the 3 areas that Thermage addresses. And this is a very prissy, tricky, very bright attorney who's highly educated but very particular. She left and called and booked the procedure. It's very expensive, but it has no downtime. It suits her personality because she's particular. She's got beautiful skin, but she's just starting to sag. She's in her early 50s. She doesn't want to get older looking. Yes, she doesn't want to spend money, but in fact, women are much better than men at spending money to look their best. They know it's sort of part of our society. So I have to say, not unrelated to our webinar this evening, 90+% of my patients are women. They're much easier to deal with because they come in knowing what we do. They know it's not free. They know we're experts, and they ask us what we can do to help them. And for the most part, they then go ahead and book. And so it does help to drive patient retention. We try to recommend, as I mentioned, Thermage over 50 every 18 months. But of course, almost none of our patients do it because they've got other things on their mind, and it's not inexpensive. So it's nice to have information in the waiting rooms for people's memory to be jogged. Gee, I haven't had Thermage in X. Or you have staff calling patients, which we did earlier this year. We looked at a list of all my patients who hadn't had Thermage for 18 months or more. 100 and something were called. Actually, they received a letter from me. We never offered discounts in our practice, but what it said was, should you decide to pursue another Thermage, which Dr. Dover recommends, we will reduce your fee by X, which was a minuscule amount. I think it was $100. Something like 25 patients booked Thermage, which is a very expensive procedure. I got to tell you, the $100 savings for them was fantastic, but the revenue for our practice and retention, because of course, when they come in for the hour procedure, our nurses talk about the other things that they haven't yet done or are thinking of doing. They read our brochures, they read our newsletters. So it's the best way to retain patients. Do a procedure that works. Clear and Brilliant takes about 15 to 20 minutes, unlike Thermage, which takes an hour. We have it done by an esthetician. We put anesthetic gel on for 30 minutes. The procedure takes about 30 minutes. The entire visit is 1 hour. It's a very lovely procedure in our med spa, which is very attractive. It's not expensive, and it works in every single patient. So there's 100% yield with this procedure. Of course, it doesn't get rid of every brown spot and every fine wrinkle and every dull skin patch, but it does improve, which is why we recommend a series. What's nice about it is up on the right, quick recovery for patients, which is important. And then Fraxel, of course, which is the gold standard of all fractional devices. It can be delegated. We delegate it now to some of our most senior nurses, but we have two kinds of Fraxel. Fraxel done by the doctor, Fraxel done by the nurses. The nurses one is significantly less expensive, but it's done by a nurse. I'm not in the room. I do the consultation, but I'm not going to be there. But I try to encourage my patients to do that because my schedule is so busy. I'd rather it be done by our nurses and revenue generate a little bit less than have them not come in at all because they can't get on my schedule. And while I'm treating other patients, these can be treated by my highly skilled nurses. And the nurses actually love doing this because they're empowered to take care of patients. They take a lot of time. They take pictures before and after. They do the consent. They talk about other things the patient could be doing. And then, of course, the patients get referred back to me. And depending on how you do the Fraxel, the downtime is from 2 to 4 days. Depends on how aggressive you are, how many passes you do, what settings you use. But in general, it is a downtime procedure with redness and swelling and a little bit of crusting or sandpaper-like change. So it's important. Patients must know this is not a no downtime procedure where they're going to go out with their friends right afterwards. So here they are in a nutshell, graphically shown: Thermage FLX for tightening, Clear and Brilliant for tone and color, and Fraxel for more tone and color. The Thermage is a monopolar RF device. The Clear and Brilliant Touch is 2 lasers in one box, 1440 and 1927. One for deeper textural change, one for color, 1927 for color, 1440 for texture. And then the Fraxel, another 2 wavelength device in the same box, 1550 for tone and especially for tightening and fine wrinkles and acne scarring, where 1927 is more for the color and brightness of the skin. Some of my colleagues do both on one day, but remember, you have to do half of each. If you do a full 1927 and a full 1550 on the same patient on the same day, you will have profound swelling and it's not going to be a fun time for the patient. So we never do that. So let's go and we'll look at these one by one. Let's talk about Thermage first. Thermage FLX is the latest version of Thermage. It's monopolar RF. It has capacitated coupling, which I'll explain, and it's a totally non-invasive, no downtime procedure. Pardon me. So this was designed with both the esthetician and the nurse and the patient in mind, and of course the doctor too. Now in our practice, Thermage takes about 45 minutes to an hour to do. That's far too long for someone with my energy level to sit still and do. Plus, it's not the best use of an hour of my time when I could be seeing 5 other patients, let's say. So we delegate this only to registered nurses who are highly skilled, who we have taught in a special training program, which we institute. And once they've done a bunch of supervised cases, they're then permitted to treat on their own. What we love about the new FLX is it was totally rebuilt with a new screen, and most importantly, a new handpiece, which is very light, very comfortable for the small hand of a nurse or esthetician, so that it's comfortable and you don't get that arm or wrist fatigue. It also has multi-directional vibration built into the tip, which actually, because of the pain gate theory, or gate theory of pain, it actually distracts the patient with vibration so they don't feel the discomfort of the RF as much. Some patients, however, prefer for this to be turned off, and of course that's up to the treating individual and the patient. These new treatments are 25% faster than the original, and most importantly, we have optimized energy delivery. So with every single pulse, the RF feeds back to a server mechanism to make sure that the RF delivered is exactly what was measured or determined on the screen. So the screen has a setting, and every single pulse measures the RF delivered to make sure it's accurate and then adjusts it up or down accordingly. So you optimize each pulse, and that's the reason we get better results with Thermage FLX than with the predecessor. So this says it smooths and tightens and contours skin, but really it's a tightening device. It's for mild sagging of the skin. There's integrated cooling, which is essential for protecting the overlying epidermis, because you don't want blisters or scabs, which of course could lead to infection and scarring, which we have never seen. And it's compatible with other procedures. We have done studies that are published to show you can do Thermage on top of filler, and it does not impact it whatsoever. However, if a patient came in today and wanted to have thermage and fillers, we would not do them on the same day. We would do the thermage first, and we could do filler afterwards, but if they're not far away, which is in most cases, patient lives nearby, you bring them back the next week. How did the thermage go? Why don't we do some filler today? So we talked about this AccuRep, which is a very fancy marketing term. Basically, it integrates the tuning of the pulses with each different pulse so that you have optimal delivery of RF between pulses. And there are 4 different tips you can use. We tend to use the total tip 3.0 centimeter squared tip for most of our faces, and we use the I-tip to treat the upper and lower lids. And here's some examples of thermage. On the left before, immediately after in the middle, and then on the right. And I don't know if you can see my pointer. I'm hoping you can, but there are 3 areas you want to focus on in these treatments. You want to focus on the small fold just lateral to the oral commissure. You want to focus on the jowl, pre-jowl and post-jowl right here, and you want to focus submental. Now in these pictures, you can only see the improvement lateral to the oral commissure and along the jawline, but this is a perfect patient. She's probably in her 40s. She has just mild to modest sagging. We don't treat patients with moderate to severe sagging because it just doesn't work, and they come back very disappointed. So handpicking the patients carefully is the key to our success, and that's how you end up with 94% satisfaction. You pick patients, men or women, with early mid-facial, that is, around the mouth facial and upper neck sagging, and we get beautiful results like this, which is reproducible. Here's another patient, same thing. Hopefully you can see my pointer, but if not, you can see a tiny fold of skin just lateral to the oral commissure. You can see her jawline, which has a small area of sagging, and you can see submentally she actually has a moderate amount of sagging. Look at her afterwards. 4 months afterwards, all 3 areas are improved dramatically. These are professionally shot pictures. No one would complain that her face is not in the Frankfurt position. I would say these are high quality images, and she has distinct improvement, but she didn't have a lot of sagging to start. She just looks way better. Now, one tip I'll share with you is we take pictures of all these patients. They're not professionally shot. They're shot by either me or one of our nurses. They're adequate, but they're good enough to be able to take pictures afterwards to show the patient the difference. About a third of patients who have thermage treatments done come in and say, I'm not sure it worked. And then you pull up the pictures and about 99% say, I didn't realize I looked like that, because of course, who remembers how they looked before? Almost nobody. That's why these pictures are so important. And finally, here's a young woman. She's got significant sagging at the base of the nasolabial fold, at the oral commissure, along the jawline, and in the submental area. And you can see there's dramatic improvement. This is predictable, reproducible. About 94% of patients have satisfactory results like this when doing thermage. You notice we're not showing you very saggy individuals. Women and men who come in with a lot of sagging do not do well. I'll give you a case in point. I take care of this gentleman. He's a self-made zillionaire, highly successful entrepreneur. He's in his 70s. He comes in, he says, Dover, I want thermage. I said, excuse me, Mr. X, but I don't think it's going to help. You have too much sagging. Really, if you're going to do anything, you need a facelift, which you may not want to do. Dover, I want thermage, book it right now. That's the kind of, he actually said that, I'm quoting what he said. I said, Mr. X, I'm writing in the chart that you're not going to respond, but we'll do it anyway. And he's got more money than God. So, I mean, it's his money. He wants to do it. Okay, fine. We booked the procedure. He comes back 6 months later. He said, Dover, it didn't work. I said, I know it didn't work. I told you it wasn't going to work. He said, you're right. What's the name of that plastic surgeon? Bingo. He went and had a facelift. He was the wrong candidate. But most people, for them, several $1,000s is a huge amount of money. So you do not want to mislead patients. So if they have a lot of sagging, I would not recommend doing this procedure. So now let's talk about clear and brilliant touch. All skin types, 2 wavelengths, 1440 and 1927. Look at this, 4.3 on a scale of 5, very satisfied customers when you ask patients how satisfied they were with Clear and Brilliant Touch. There are two handpieces in this new device. One that delivers 1440 and goes more deeply into the tissue, and one at 1927, which goes more superficially. So 1927 is better for tone and color, 1440 better for textural improvement. And we often do both now on the same treatment. The new touch, you can switch from one handpiece to the other by just hitting a button. It takes a matter of a few seconds, and we get very nice results. So we do what we call the fusion procedure. It's just a term we use, which our estheticians came up with. Fusion treatment is a combination of half 1440, half 1927. The tip comes off, it looks like this, has these beautiful magnetic rollers. The handpiece is very gentle and light, easy to do, easy to learn. Obviously, it takes a lot of touch, and that's why the estheticians are particularly good at this procedure. Here's what the device looks like. It's tiny, it weighs just a couple of pounds. It sits on a table in our aesthetic suite. We do not move it around except sometimes from room to room in this med spa, but we don't carry it all around the corridors. But it can go into a special box and can be transported in your car from office to office should you want to do that. And I don't want to talk in detail about the screen, but it's beautifully designed and very elegant, and looks much nicer than the original, of course. And just a couple of examples. This from Brooke Jackson, one of our previous fellows. Young woman whose skin looks perfect, but it looks better afterwards. Brighter or even in color. Here's a woman of color, skin type 4, before and after 2 treatments, also from Brooke. And then finally, one where you'll see more improvement, very attractive woman. She's got some red tone, she's got some brown on her cheek. Now, we tell patients it's not going to help sagging, but it will help to brighten their skin and make their skin more functionally better. And it probably decreases the risk of skin cancer, but it's not been shown with this specific device. That's been shown with the Fraxel. And then the Fraxel itself, here's the handpiece. It's a bigger device, much more expensive, louder, more versatile though. It's got 2 wavelengths as well, 1550 for deeper penetration for acne scarring and texture, 1927. It's a fiber laser, it's thulium as opposed to erbium glass, 1927 better for superficial. And so we sometimes do both on the same day, but usually I separate them out. I do way more 1927 than 1550. Why? Because many of my patients who want Fraxel come in with dull skin, lentigines, and they're missing the glow on their tone is what's really bothering them. So we improve tone, texture a little bit, but especially color. And that's why 1927 is used preferentially in our practice over 1550, but we have both. Both lasers come in the same box. You hit a button, and very cleverly, the man who designed this, Len Benedictus, a brilliant engineer, made it so it switches from one laser to the other, but it comes out of the same handpiece. It was the first fiber laser ever developed for medical use. And we'll skip that slide. Here's a picture of what the device looks like. The handpiece, built-in cooling, without which it would be too uncomfortable. Anesthesia for about 60 minutes beforehand. It's uncomfortable while you do it and for 1 hour afterwards. But after that, patients are remarkably comfortable. And I've had this done now a handful of times. And I got to tell you, just when you think, I hope the pain goes away soon, it goes away. Usually about 60 minutes, occasionally 90. Ice helps with swelling and discomfort. But most patients tolerate this incredibly well, except for young teens with acne scarring who don't do well with anything. So you have to work with those individuals. Here's the handpiece with the built-in cooling. 1550 for deeper sun damage. This wavelength's been shown to prevent actinic keratoses and probably prevent skin cancer, non-melanoma skin cancer. 1927 surely helps actinic keratoses and non-melanoma skin cancer. And while we do a lot of patients for cancer prevention, the number 1 use of Fraxel is for dull skin and uneven color, by far. And here's some nice examples. Here's a young woman with basically with freckles, just after a single treatment, dramatic improvement of her skin. Now you could use IPL and you could use a Q-switch ruby or alexandrite or ND-YAG, but wouldn't it be nice to just paint the laser on? That's exactly what's done in this case. Here's another example of a woman using 1550 for melasma. It's approved for melasma, but I personally find the Clear and Brilliant Touch more effective for melasma. And here's a striking example, not the best pictures in the world, but focus on her color. You see the brown discoloration on the left after 3 treatments, Elizabeth Rustin, my colleague from North Carolina. A beautiful result the woman looks 15 years younger, and all that Dr. Rustin did was to improve the overall color and tone of her skin. That's why these devices are so successful. This was 1550 before the 1927 was available. Hard to believe, but we get even better results with 1927. And finally, acne scarring. My favorite treatment for acne scarring is 1550 Fraxel. Now, this is quite striking after one treatment. Usually we do as many as 6 for these patients, about a month to 2 apart, and we get predictably good results with this procedure. So you can diversify your med spa offerings and grow your practice, grow your dermatology practice, your aesthetic practice by rejuvenating with Tighten and Brighten, Thermage, Clear and Brilliant Touch, and or Fraxel, same day, different day. Depends on what you want out of your practice and for your patients, but they're beautiful procedures. And the reason this works so well is there are practice opportunities. These are patient satisfaction focused procedures with very high patient satisfaction. Now in our practice, we have huge numbers of devices. We have 14 dermatologists. We saw 75,000 patients last year, as I mentioned. The 2 best technologies in our practice are Thermage for non-surgical facial tightening and the Fraxel franchise, I'll call it, Clear and Brilliant Touch and the Fraxel. And the reason is there's nothing else that tightens with no downtime. There's nothing else that improves overall skin tone, texture, color than fractional resurfacing. And so with these 2 devices, they're really the workhorses of our practice, and I could not practice without them. So with that, I'm going to close. There are just a couple of slides I have to show you on indications and important safety information on Thermage and on the Clear and Brilliant and the Fraxel. But at this point, I'll turn things back over to our moderator. Thank you all very much for your attention.
Wonderful. Thank you so much, Dr. Dover, for sharing your wonderful insights with all of us on Tighten and Brighten. So we'd like to take the time now to designate this for the question and answer portion of our webinar. You may ask your questions now in the Q&A feature on the Zoom platform, and we'll take the next few minutes to answer questions as they come. So Dr. Dover, we actually have a few questions already. There is a question asking, do you recommend Thermage as a prevention of anti-aging for younger patients?
So this is a very important point, and I'm so glad you brought it up because we did not discuss it in the formal part of the presentation. I'm not sure what it is exactly, but firstly, you've all heard of prejuvenation, I think, or preventative aging. Turns out that was a term coined by Dr. Kenneth Arndt, my mentor and the lead physician in our practice. He wrote a paper a few years ago called When is Too Young Too Young? And he came up with the term prejuvenation. And the answer was, there's never too young. It's just that what's just the right time for that individual? And it turns out now prejuvenation is very common in America. I see patients now daily. I saw 2 today alone, brand new patients who came in and said, I want to prevent getting older looking, which is actually not unreasonable. I mean, none of us really want to look older. We know we're going to get older, but wouldn't it be nice if we looked younger than our age and not older? The Asian population, at least around the Boston area, has really caught on to using Thermage for preventing sagging. I'm not sure how it happened exactly. I've not found the source. I see large numbers of Asian women of different Asian backgrounds, Chinese, Cambodian, Laotian, Vietnamese, in the Boston area who come in and say, I'd like to have Thermage because I've got sagging. Now they don't have sagging. They're 30 years old, maybe 40, beautiful young women, but it actually works. The key is to make sure you get pictures before and after. Explain to them they already look wonderful. They're not going to look a lot better. People will not stop them and say how much better they look, but it will help to reset their sagging back by a certain amount. And you can show them that graphically and say, I think it's a good idea. So we do that a lot. That's our most common group who does prejuvenation with Thermage, but why not actually do it on a somewhat regular basis? So I think that's an opportunity for practices who don't do it. If you have anything in your practice that talks about prejuvenation or preventing aging, Thermage, I personally think, is the best way to help to prevent sagging. Now, we have no data to prove this will prevent the need for facelift, but that's the reason I do it every 12 months, because I know what my father looked like in his 90s. He had sagging. I know what my mother looks like. She's 92. She's lovely, but she's 92. So I do it on a regular basis. I've done maybe 5 or 6 in a row now. I never miss December 1st every year. And that's what we try to encourage for our patients.
Great. Thank you, Dr. Dover. We have another question asking, Thermage is so technique driven. How do you ensure your nurses are properly trained to perform the treatments?
That's incredibly important. I go to meetings and I'm stopped regularly after lecturing by colleagues of mine who are very senior and very well known. They say, how come Thermage works so well in your practice and it doesn't work in our practice? So I ask 3 or 4 questions. What device do you have? The answer usually is, oh, I've got 2 technologies old, like 10-year-old technology. Okay, that's the wrong answer. Number 2, I say, who chooses the patients? Well, whoever. I say, who does the procedure? Well, whoever's free. When was the last time they had an in-service from someone at Solta to teach them about the new techniques? Never. So I'm talking about a colleague in Point who's very well known, like world famous, and they don't get good results in Thermage. They pick sagging old women, I know. Their nurses don't know how to do the procedure, and they've got very old technology, 2 generations old. I say, why don't you get the FLX? Why don't you have the trainer come in? Why don't you learn how to pick the patients? Why would it work in my practice and not somewhere else? That's ridiculous. It's because they're picking the wrong patients and they're not doing it correctly. So we have a head nurse called Andrea who is incredibly bright, like as bright as any of our doctors. And she's in charge of teaching Thermage technique to our staff because she's such an expert in doing it. She's been doing it for years, but not everybody has an Andrea, but everybody has a Solta. You contact the company and say, we'd like to have an in-service. You make sure that people who are doing the procedure are totally free during the in-service, not busy running out of the room when the trainer's teaching the most important points. But it's up to you to make sure your staff does it perfectly, not just adequately, and not, oh, there's only one person in the practice who can do it and she just had a baby, so she's off for 3 months. Well, that's no good. So you have to have enough people who can do it, but not too many, so you dilute the experience.
Great. Thank you, Dr. Dover. Another question is asking, are you starting almost everyone in the high treatment setting with Clear and Brilliant, or what treatment setting do you start them on?
Well, that's a great question, but since I don't do the procedure, we'll have to ask my estheticians. But usually what we do is we build up. What I can tell you is we often do what we call fusion, 1440 and 1927 on the same day. And what you want to do is dial it into the patient. So you have to ask the patient, if you've got some prima donna who's out at benefits 4 nights a week, the last thing you want to do is high settings. She will never come back to your practice, and she will tell everybody she knows that you don't know what you're doing in your practice. So you start her very low. If you have someone who's on a strict budget who says, I can only do this once or twice, you say, why don't we go to the higher settings? You're going to have a little more downtime. It'll be a little more uncomfortable, but you get more bang for your buck. So you want to dial it in. Make sure you ask the patient what they would like.
Another question is asking, can you explain the difference between the older model of Thermage and the new FLX?
So the new FLX in general is 25% faster, has a way more comfortable handpiece. It's much lighter and much more ergonomically developed to try to prevent any wrist and hand fatigue, which was a real issue with previous devices. The vibration is more uniform, and it has feedback of the RF delivered with every single pulse. We do 900 pulse procedures. I want to make sure it's not dropping down after pulse 12 for the next 60 pulses and delivering less than I thought. So the older devices didn't have this AccuRep, which means it's just a fancy term for feedback loop, so that the device delivers exactly what it says on the screen every pulse. All those are the reasons it's changed our practice. And since switching to the FLX, which is now a few years ago, we were one of the first practices in the nation to get it. And after a bit of trouble with the device, because new devices often have a few little glitches, our Thermage business is up dramatic double digits year over year, every single year, including this past year, even during COVID. It's actually quite remarkable, and that's because the results speak for themselves. So I would encourage everybody on the call. My bias is I feel strongly about these devices, but I do not own shares in the company, and I'm obviously being paid for my time to do a webinar, but that's my only conflict of interest. My biggest conflict of interest is I like these devices a lot. We use them a lot. I've had the procedure myself. I don't want to recommend something that isn't the best in class. So Thermage is best in class for skin tightening, non-surgically, but you've got to get the latest technology. And it's not one of those, oh, the company just wants me to buy a new device. It's the same thing. They just want me to buy a new unit. Clearly, they'll work with you to replace your old device with some sort of, I don't know how they do it exactly, but they did that with us because we already had the devices and we paid a lot for them. So you want to make sure what's fair to you is fair to the company too. But I'd look carefully at FLX. I personally think it's a huge advance.
Great. Then we have another question asking, can you please share some verbiage and explain how Fraxel helps prevent skin cancer?
So in a nutshell, both 1927 and 1550, but especially 1927, replaces the old epidermis with new epidermis. And skin cancer is from epidermal maturation disarray, these abnormal keratinocytes in columns along the epidermal dermal junction for actinic keratoses, and in in situ squamous cell, it's full thickness epidermis, which is altered with abnormal keratinocytes. Well, these keratinocytes are replaced totally by a series of Fraxel procedures. So you literally replace abnormal epidermal keratinocytes, which are in the lineage to form skin cancer, with brand new, fresh ones, which are totally normal in lineage. So clearly, it makes sense that it would decrease the risk of skin cancer. But now there's been a brand new paper from Dr. Avram at Mass General just earlier this year that showed even a single 1550 procedure decrease the risk of actinic keratosis and skin cancer. So we do a lot of this. I have patients who travel from 4 states away. I have one young woman, she's had 7 skin cancers on her face already. She comes in every 6 months. She never misses. She has lily white, perfectly smooth skin. She's never going to get a skin cancer on my watch because we're seeing her so regularly. And so we offer that to a lot of patients, and now they get referred in by their dermatologists saying, go see Dr. Dover. He's got a device which will decrease the field effect of all your, what we call field cancerization, where every spot on their skin is a potential risk for skin cancer.
Okay. So then another question is asking, Fraxel has been around for a long time. Does it really work as good as the new devices out there?
Well, Fraxel actually works better than any other fractional laser device on the market, and the competition all knows that, which is why they use the term Fraxel to call their devices, which are not Fraxels, Fraxel. Remember, Fraxel is a trademarked name owned by Solta. It was invented by Rox Anderson and Dieter Manstein at Mass General. They licensed the technology to a company called Reliant, which became Solta, which then became Bosch. But they're the only ones who have the fractional technology that was designed and developed in the labs at Wellman Labs at Mass General. Other companies make fractional devices, but they're all knockoffs. So we have other fractional devices which have come and gone, but we don't use any of them because they're not as effective, they're not as sleek, they don't work as well. So fractional, the true Fraxel, there's nothing like it, and all the competition knows it. So you can get a less expensive device, I can assure you. We have fractional CO2 devices made by other companies, but we would never use a non-ablative fractional device from any other company, but from Solta. And that's the reason we have 3 of them, and we've bought them all. And that's because they're the best in class, and everybody knows that. And that's why you go to some offices, they say, I'm going to do a Fraxel, and you think, that's not a Fraxel. Why are they calling it Fraxel? And of course, it's illegal what they're doing, but no one stops them. But if a whole chain or a laser company said, we're going to sell Fraxels and branded their device Fraxel, that would be infringement and there'd be a lawsuit. So I encourage you to look very carefully at Fraxel. I for one, believe it's now 10 years plus on, it's by far the best franchise in our field.
Dr. Dover, can you share any tips and tricks in your treatment protocol to yield consistent results with each Thermage treatment?
Yeah, I think the best thing to do, as I mentioned earlier, is to, if you haven't already, have the educator from Solta either do a webinar for you, which I know they will do. They'll come online for an hour with your treating staff, or they'll come to your office. The key is, number one, make sure you do enough pulses. So just doing spot treatment, like patients will come in and say, oh, Dr. Dover, I've got sagging around my mouth. Let's just do thermage around my mouth. I said, well, that's not the way we do it. We do the entire lower face and the upper neck, because if you want to tighten your mid cheek, where would you pull? Right here. So you've got to do all the vectors, tighten this entire area. So number one, we do minimum 600, but usually 900 pulses on the lower face. Number two, we go over the same area repeatedly over and over. Number three, low energy, multiple passes is the key to the 94% satisfaction rate in the big study that I mentioned earlier. And then you want to make sure that the person doing it is very comfortable, that the patient's comfortable, and you go on and on. You go to the highest setting that the patient can tolerate without torturing them. So someone like me, skinny guy with not a lot of facial fat, we use lower energy. Fat, remember, is a great insulator. So the rounder a face or the fuller the face, the more fat there is, the less it hurts, but the less the RF converts to heat. So for women and men with a more chubby face, you go to higher settings. For someone skinny like, say, Giselle Bundchen, who's got an angular face, you go to lower settings because it would hurt her too much. But those are my tips in general. The key, high number of pulses, lots of passes. Make sure you use the grid. Do not do it freehand. Anybody who does it freehand is making a mistake as far as I'm concerned. You want to put the grid on. You want to follow the grid. You never do the same spot over and over again, because then you can get bulk heating. But in general, technique is crucial for this, like all procedures. But even most important, or more important than that, is picking the right patient, right? Someone with a lot of sagging, forget about it. You want someone who already looks pretty good. You saw all those pictures. They all had mild to modest sagging, not moderate to severe. Those patients really need other approaches. Threads, if you're into that, I'm not. Surgical approaches, facelift. I sent a lot of patients for facelift surgery.
Great. And then if someone is doing an RF microneedling and Fraxel on the same day, which one should be done first?
Well, firstly, I would do thermage rather than RF needling, because I think it actually works better. And I personally wouldn't do RF needling and Fraxel on the same day if it was my choice, not on my own face. I would do them on separate days. But you could do them, and if I was going to do them on the same day, I'd do the RF needling first, followed by Fraxel. Because that way, you do have a little epidermal damage with the RF needling, which you don't with thermage, one of the other advantages of thermage. But I'd probably go RF needling deep first, then superficial, rather than the other way around.
Do you use any eye protection when you perform any of the treatments?
Well, the operator definitely has to, depending on what we're talking about. So let's go one by
For the
one.
patient.
So for the patient, for thermage, they only need to have their eyes closed, because it only delivers energy where the applicator is in contact with the skin. So for thermage, there's no eye shields, but the eyes obviously you want to have closed. For Fraxel, remarkably, because it is a contact delivery device, only where you contact skin will it deliver Fraxel. And to actually be able to Fraxel, say, the cornea, would be close to impossible. But when we first started doing this years ago, our nurses were petrified, because they were all trained with lasers and IPL. And they said, well, what about goggles for the patient and for us? So all of our staff wore goggles, special goggles for 1927 or 1550 when they were doing the procedure. But they slowly but surely shed them, because there's no risk, it turns out, with Fraxel 1927, 1550, or Clear and Brilliant 1927, 1440. So neither you nor the patient needs to wear goggles for thermage or Fraxel or Clear and Brilliant. Now, other devices, you actually do need protection.
Great. Thank you, Dr. Dover. We have quite a few more questions, but unfortunately, we are coming to the close of the webinar time. So we want to thank you again, Dr. Dover, for your wonderful insights on Tighten and Brighten. And we want to thank everyone who has joined us this evening to listen to Dr. Dover's presentation. If you have any other questions, if we did not get to your question, or you have any feedback or further inquiries, please feel free to email us at info@solta.com. Again, please direct any further questions or inquiries to info@solta.com or contact your local representative. And please continue to check your inboxes for our latest webinar invitations. We look forward to seeing you all again in future programs and hope you have a wonderful evening.